Hi, my name is Brittany Moore. I am a family nurse practitioner student with United States University, and I am completing my head-to-toe assessment exam today. Today is November 16th. I'll show you that. It is November 16th at 7:08 p.m., and my phone is on the sleep mode, so it won't be disturbing me. I just want to introduce you to my volunteer. Can you tell me your first and last name?
Dylan Rose.
And when's your birthday?
September 14th, 2006.
And are you the same person who filled out the consent form?
Yes.
Okay, and then I just need to let you know that this assessment is going to be recorded and uploaded to YouTube as unlisted so my professors can view it and grade it, and then possibly other staff members for auditing purposes. Do I still have your consent?
Yeah.
Okay, and then just to let you know, this exam is for educational purposes only, so if there are any abnormal findings, you'll need to contact your primary care physician, okay?
Okay.
And you are over 18, correct?
Yes.
Okay. All right, so he's able to consent for himself. He is over 18 years old, and so I just wanted to start with that. I also want to let you know that I am following the United States University Student Code of Conduct, and I am acting with honesty and integrity, and I am doing this assessment completely from memory. I am not utilizing any outside resources, and I am not utilizing any other help. There's no one else in this room. It's just the two of us. And so I will start with my room scan. So we'll start over here on this side. And then there is the bed. There's the TV. It's turned off. And everything over on this side. This is just a blank white sheet for draping. And let's see. All of that. Oh, and I need to show you my ears. Let's see. That is the stand where my computer is. And the ceiling. And here is the floor where I'll be working. There's a little stool that I'll be utilizing as well. And just so you can see, there is my computer. And there's nothing there. And then I'll show you my supplies. I'm also showing you my ears. So my ears there, and then you can see the back of my ear in the mirror. And then the front of my ear. Whoops. And then the back of my ear that way. I hope you could see that. There's nothing there. And then my supply table is all right here. So I have all of my supplies. And then I have my blank dump sheet. And then my card. And I think that completes my room. Oh, actually over here, just so you can see. There is nothing over here. So I will go ahead and let me get this in the right spot and get started. Okay, 3:13. My dump sheet really quick. Okay, I will go ahead and get started. I'm first cleaning my hands with hand sanitizer. Hi, my name is Brittany Moore. I'm a family nurse practitioner student with United States University. How are you today?
Good.
Good. I'll be completing a head-to-toe assessment on you. Do you have any questions?
No.
Okay. well, let's go ahead and get started. Can you first tell me your first and last name and your birthday?
Dylan Rose, September 14th, 2006.
Okay, and your age?
19.
And your gender?
Male.
And your race and your ethnicity?
White Caucasian.
Great. And what did you come to the clinic for today?
An assessment.
Okay, for your physical?
Thing.
Okay, so an assessment for school. Okay, do you have any health conditions that you would like to discuss today?
No.
Okay, if my patient had any concerns, I would address them using the old carts method, which is onset, location, duration, characteristics, aggravating factors, relieving factors, timing, and severity. But we'll go ahead and move on. Can you tell me about your overall health? How do you feel about it?
Good.
Okay, and then when was the last time you went into the doctor for an annual physical?
Last year.
Okay, and did you have any tests done at that time?
Not that I know of.
Okay, we can look at your records and see if they did anything, but they may not have. But and then what about a dental exam and an eye exam?
Yes.
When did you?
Dentist was like 5 months ago, and the eye was like 2 months ago.
Okay, did you have any abnormal findings?
No.
Okay, awesome. And then do you have any chronic conditions that you manage?
No.
Okay, and if you said yes, I would follow up with the diagnosis, the date, and the treatment. And then do you have any psychiatric history?
No.
Okay, and if he said yes, I would follow up with the date, the diagnosis, the treatment, and any hospitalizations. What about any infectious disease like HIV, AIDS, tuberculosis, hepatitis?
No.
Okay, if he said yes, I would follow up with the specific diagnosis and the treatment and the date. And then what about allergies?
No.
Okay, if he said yes, I would follow up with the allergen, the reaction, the severity of the reaction, the treatment. And then what about any medications?
No.
Okay, if he said yes, I would follow up with the name of the medication, the dose, the indication for the medication, the duration, and the frequency that he's taking it. And then what about any surgical history?
No.
Okay, if he said yes, I would follow up with the type of surgery, the reason for the surgery, the date, any complications, and and any anesthesia that may have been used. And then what about any injuries or hospitalizations?
No.
Okay, and I would follow up again, asking about the specific injury or the specific reason for the hospitalization, the date, and the duration and treatments. And then what about your immunizations? So childhood vaccines, and then your influenza and your COVID vaccine.
I don't think so. None of them.
Did you have any childhood vaccines?
I can't remember.
Okay. And then what about, did you have an influenza vaccine this season?
No.
Okay. Did you have a COVID vaccine at all?
No.
Okay. If you're interested in any of that, it is flu season. We can definitely talk about getting a flu shot, and I can give you some guidance on any of the vaccines if you're interested, okay?
Okay.
If my patient was a female, I would follow up with the gynecologic history. I would ask about the last menstrual period. I would ask about the date of an age of menarche. I would ask about the characteristics and the pattern of the menses, the gravidapair score, and then any menopausal symptoms if the patient was of age. And then what about any, I'm going to ask about some sexual history. Are you sexually active?
No.
Okay, have you ever been sexually active?
No.
Okay, if my patient had said yes to that, I would follow up with the number of partners, the sexual preferences, and then any sexually transmitted infection history or testing, and then any information about future pregnancy plans, and then any protection being used. And then what about some health maintenance? So do you do monthly testicular self-exams?
Yes.
Okay, and then what about monthly self-breast exams?
Yes.
Good. So men can get breast cancer too, so it's really important that you're checking all of that out, and if you have any concerns, you follow up with your primary care, okay? And then the American College of Obstetrics and Gynecology recommends females between the ages of 13 and 15 have their first gynecologic exam, and then between the ages of 21 and 29 get pap smears every 3 years, and then between the ages of 30 and 65 have a pap smear every 5 years with co-testing for HPV. And so now I'm going to move on to some family history. So first of all, you said you weren't sexually active, so you don't have any children. You can follow up, okay? And then do you have any siblings?
No.
Okay, are your parents alive?
Yeah.
Okay, both of them? Do you know how old they are?
In their 40s.
Okay, do you know if they're healthy?
Seem healthy.
Okay, and then what about your grandparents on both sides? Both sets of grandparents, are they alive or are they deceased?
Alive.
Okay, and do you know how old they are?
Like late 60s, early 70s.
Okay, do you know if they're healthy?
To my knowledge, yeah.
Okay, great. Okay, so I'm just going to ask you some questions about some of the systems of the body. Some of these are some conditions that some systems of our bodies can have. So just answer them to the best of your ability, okay? Do you know if anyone in your family has had any issues with like hearing loss or cataracts or glaucoma or any nasal polyps or any frequent strep throat?
No.
What about heart failure, hypertension? Okay. And then what about any Alzheimer's or Parkinson's?
No.
What about any asthma or COPD?
No.
Okay. What about any GERD or GI bleed?
No.
Okay. What about any prostate problems or kidney stones?
No.
Okay. How about any thyroid disease or diabetes?
No.
Osteoporosis or arthritis?
No.
Is anyone in your family obese?
No.
What about any cancers? This could be like colon, skin, breast. Okay.
No.
What about any hematologic problems? This could be like hemophilia or von Willebrand's disease.
No.
Okay. What about any anxiety, depression, schizophrenia?
No.
What about cystic fibrosis or Down syndrome?
No.
Any substance abuse?
No.
And then any allergies. This could be to medications. This could be to food, environmental, latex, anything like that. And then just to follow up and go back to your allergies, I forgot to specify, do you have any allergies to any of those substances? It can be food, environmental, medications, or latex. Okay, thank you. All right, and then we'll move on to some social history about yourself. Can you tell me where you were born?
California.
And then what is your marital status?
Single.
Okay, and then can you tell me you already told me your race and your ethnicity, which, can you repeat that?
White Caucasian.
And then what's your nationality? That's like the country that issued you your passport.
United States of America.
Yeah, so you're a United States citizen?
Yeah.
Okay. And then you said you're single. What's your occupation?
Home Depot.
Okay. And do you have any military service?
No.
And then what's your living situation? Who do you live with and where do you live?
My parents' house.
Okay. And then can you tell me about your habits? Let's first start about your diet. Do you have any dietary restrictions?
No.
Okay. And how are you eating?
Good.
Okay. Do you eat like well-balanced fruits, vegetables, proteins, whole grains?
Yeah.
Okay, good. And then how's your hydration? How much water are you drinking per day?
Like a gallon.
Oh, that's good. Okay. And then what about your exercise?
Like 5 times a week.
Okay. Do you do any cardio or just weightlifting? What type of exercise?
Cardio and weightlifting.
Okay, great. And then do you feel like your nutrition that you're eating is supporting your nutritional needs?
Yeah.
Okay. And then do you use caffeine?
Yeah.
Okay. How much caffeine are you drinking per day?
200 milligrams.
Okay. And then what about any laxative use?
No.
Okay. And then how about any substance abuse? So
No.
this could be like alcohol, illicit drugs, vaping, tobacco, or nicotine.
Nope.
Okay. That's good. And then what about your stress and your emotional status? How do you feel?
Good.
Okay. Do you manage your stress well?
Yep.
Okay. And then how much are you sleeping? How's your sleep habits?
Good.
Okay. How many hours per night are you sleeping?
8.
Okay. And then what about your leisurely time? What do you like to do in your time off from work?
Work out.
Okay. Do you do anything else?
Nope.
Okay. And then do you feel, do you have any alternative health practices like yoga, chiropractor?
Nope.
Okay. And then what about just overall, do you feel safe? Have you ever been a victim of domestic violence?
Nope.
Do you feel safe at home?
Yep.
And then what about, are you acting safely like when you're driving? Do you wear a seatbelt? Do you text and drive?
Nope.
Okay, good. And these are just going to be next questions are about some review of systems about yourself. So tell me if you have any of the following, okay? Overall, you said your health, you feel pretty good, right?
Yep.
Okay, and then do you have any fever, chills, weakness, fatigue, or weight loss?
No.
Okay, do you have any changes in your vision? So any blurry vision, tunnel vision,
No.
any eye pain, eye discharge, any floaters?
No.
Do you wear contacts or glasses?
No.
And your last eye exam was about
2 months
2 months
ago.
ago? Okay. What about any ear pain, any ear drainage or hearing loss?
No.
And then what about any nasal drainage, nasal congestion, difficulty smelling? Okay, and then in your mouth, any sore throat, difficulty chewing and swallowing foods, any lesions in your mouth, any loose teeth?
No.
Okay, and you said your last dental exam was about
5 months ago.
okay, and then any chest pain?
No.
And then do you have any irregular heartbeats, so like a flutter or a skipped beat, or any shortness of breath with or without exertion?
Nope.
Okay, any chest pain, or excuse me, any difficulty breathing or cough?
Nope.
Any black or bloody stools, constipation or diarrhea?
Nope.
When was your last bowel movement?
Today.
Great. normal color and consistency,
Yep.
and you're having regular bowel movements.
Yep.
Okay, any difficulty urinating, painful urination, dribbling, or frequency?
Nope.
Okay, what about any range of motion difficulties, any muscle tenderness or bone pain?
Nope.
Any skin changes, like skin texture changes, any rashes, lesions, nodules?
Nope.
Okay, and then what about any anxiety, depression, schizophrenia, delusions, any sleeping
No.
difficulties? Okay, and then any unilateral weakness, any blurry vision, any seizures, any pain or paresthesias?
Mm-mm.
Okay, and then what about any heat or cold intolerance? And
No.
then inappropriate hair growth, unexpected weight loss, inappropriate sweating? Okay, and then any like excessive bleeding or easy bruising, or does it take a long time for you to get better when you're sick?
Nope.
Okay, and then any allergy symptoms like allergic rhinitis or runny nose, and then any eczema, and you said you have no allergies, so.
None.
Okay, well, then let's go ahead and move on. So I'm going to move on to the physical assessment portion. Can you tell me the year?
It's 2025.
Great, and then can you tell me where we are?
Our my house.
Okay, and then can you tell me what we're doing here?
An assessment for school.
Okay, and so my patient is alert and oriented to person, place, time, and situation. Upon looking at him, he is well developed, he's well nourished, his posture is upright, his mobility is stable and intact, his expression is appropriate, his mood and affect is kind of flat, but appropriate. And he is in no acute distress. His respiratory rate is 16. He has even chest rise with his breathing. His hygiene is intact. He has no odors. He appears clean and well cared for. And so that is all a normal finding. Looking at his height and his weight, he is 5'11". He is 170 pounds. His BMI is 23.7, which is normal. His blood pressure is 118/76. His pulse is 72. His respiratory rate is 16. His temperature is 98.6 degrees Fahrenheit, and his oxygen saturation is 100% on room air. I'm going to have you come sit over here so I can look at your hair and your skin and your nails. So the first thing I'm doing is I am inspecting his skin. So I'm looking at all of the skin that is exposed, and I can see that his skin is, I'm just going to feel it first. It is warm, dry, intact. It's normal for ethnicity, and the skin turgor is appropriate. It's brisk. There's no signs of any dehydration. As I'm looking at his skin, there's no cyanosis, there's no pallor, there's no erythema, there's no jaundice, and that is a normal finding. There's no weeping, there's no edema. His face is symmetric. There's no facial swelling. I don't see any rashes, lesions, nodules, or any vesicles. I don't see any. He does have a few little small red acne pustules here on his chin, but other than that, I don't see any vesicular or purpuric lesions. There's no there's no suspicious tumors. There's no nevi. If I were to see any, I would inspect those using the ABCDE method, which is asymmetry, B for border color, diameter greater than 6 millimeters, and evolving. Also, I would have the patient appropriately undressed in clinic and draped. So I would be inspecting him with his clothing off. And so I don't see any maculopapules, papules, vesicles, and then just those few little pustules. And then that is a normal finding. As I'm looking at his hair is, it's thick and it is not excessively oily or dry. It doesn't have any lice, there's no nits, there's no dandruff. It's thick, it is slightly wavy, and it is evenly dispersed on his head. I do not see any signs of alopecia, and so that is also a normal finding. And so now I'm going to move on to palpating. So I'm gonna look at your nails first. As I'm looking at the nails are intact. They are, the capillary refill is less than 3 seconds. It's brisk. Nails are appropriate for ethnicity. There's no tar staining, there's no splinter hemorrhages, there's no clubbing, and there is no cyanosis on either the fingernails or toenails, and that's a normal finding. So now I'm going to move on to palpating. So as I'm palpating, I'm first inspecting the head. I'm looking at the head and the neck for any asymmetry. I see that the neck is symmetrical, the head is atraumatic, and it's normocephalic. There's no rashes, lesions, nodules, there's no hematomas or cysts that are present, and I've already stated that there was no dandruff, there's no lice, and no nits. There's no concerns that I can see with the actual scalp. So as I'm palpating, I'm not feeling any depressions. I'm not feeling any rashes, lesions, cysts, depressions, hematomas. Everything is normal, and that is a normal finding. So next I'm going to move on to, let's see, what am I going to do next? Next I'm going to check I'm going to palpate here for your temporal artery. Do you have any pain here? Okay, go ahead and open your jaw. Do you have any pain when you open your jaw?
No.
Okay, and there's no clicking, and so that is a normal finding. I'm going to palpate your frontal sinus. Tell me if there's any pain. Any pain?
No.
Okay, and then your maxillary sinus. Any pain?
No.
Okay, so there's no pain there, and that is all normal. I am going to test the cranial nerve 5 and 7. Cranial nerve 5 is the trigeminal nerve, and 7 is the facial nerve. So first, let's do the facial nerve. It's faster. Lift up your eyebrows like you're surprised, and then puff out your cheeks. Okay, cranial nerve 7, the facial nerve is intact. Cranial nerve 5, the trigeminal, go ahead and open your mouth. So against some resistance, the motor portion is intact. Close your eyes and tell me if this is sharp or dull.
Dull. Dull. Sharp. Dull. Sharp. Dull.
Great. And so he's able to identify the difference between sharp and dull with the cotton-tipped applicator on his face. So cranial nerve 5, the trigeminal nerve is intact, and that is a normal finding. And so I will go ahead and move on. So I'm looking at his eyes. As I'm looking at his eyes, I'm not seeing any hordeolums, I'm not seeing any chalazions, I'm not seeing any ptosis, I'm not seeing any exophthalmosis. I am not seeing any entropion or ectropion, and that is all a normal finding. I'm going to look at your conjunctiva, so I'm going to pull your eyelids down. So his conjunctiva is pink and moist. His sclera is white. It's there's no icterus. His conjunctiva is also free of any injections. The lens and the conjunctiva is pink and moist, and there's no injections. The sclera is white and free of any icterus. The cornea and the lens are clear. There's no opacities. And then as I'm looking at the iris, it's blue and it's round and equal, and the pupils are also equal and round. So I'm going to check to see if they're equal, round, and reactive to light. So I'm checking for perla, and as I shine the light in the bilateral pupils, they constrict from 5 millimeters to 3 millimeters. And then as I shine the light again, I can see that the opposite eye constricts when the light is shined into the other eye. So that is that is a direct light and consensual light reaction. And then I'm going to have you stare at this pen tip and then look at the picture over my shoulder. And so as he does that, his pupils accommodate for the far distance and then for the close distance by dilating for the far distance and constricting for the close distance. And so that is equal, round, and reactive to light and accommodation. So that is the PERLA acronym, and that is part of cranial nerve 3. The rest of cranial nerve 3 we'll do is with the extraocular motion. So I'm going to have you just look at the pen tip. So this is cranial nerve 3, the ocular motor, cranial nerve 2, the abducens, cranial nerve 3, the ocular motor, cranial nerve 3, cranial nerve 6, cranial nerve 3, and there's no nystagmus. And then doing cranial nerve 4 is in medial and downward motion. So as I did this, I can see the convergence, and then he is able to look down. So cranial nerve 3, 4, and 6, so ocular, motor, trochlear, and abducens are all intact, and that is a normal finding. Next thing I'm going to do is check cranial nerve 2, the optic nerve, with the Snellen chart. So I would be 6 feet away in clinic, and you said you don't wear glasses or contacts, right? So go ahead and cover an eye, and then read the smallest line of print.
LTFPH.
Go ahead and cover your other eye.
LTFPH.
Great, and then do them together.
LTFPH.
Great, thank you. So he is 20/20 uncorrected bilaterally, and that is a normal finding. The next thing I'm going to do is I'm going to do a fundoscopic exam to check for the last part of cranial nerve 2, the optic nerve. So I would dim the lights. I'm using my right hand to my right eye to his right eye. I'm coming in at 15 degrees, and I am bracing myself against his forehead. And as I come in, I see the red reflex. I see the retina is a reddish orange. I can see the cornea and the lens are free of opacities. I can see the optic disc and the cup. The cup to disc ratio is 1:3. The optic disc has sharp margins. It's a creamy yellow to pink color. I can see the macula and the fovea. I can see the veins and the arteries. I can see that there is no cotton wool spots, there is no AV nicking, and there are no hemorrhages. The arteries are smaller and lighter, and the veins are larger and darker. So now I'm going to do the other side. So I'm going to use my left hand and my left eye to his left eye, and I'm going to look for the same thing. So coming in, and as I'm looking, I'm able to see the same exact bindings on the left eye that I saw on the right eye, and that is a normal finding. So I'm going to go ahead and move on now. So the eyes are normal and intact. So now I'm going to move on to the ears. So first I'm inspecting the ears. I'm looking to see they are symmetrical. They're placed in a good spot on his head. There's no nodules, there's no lesions, no deformities. And then as I'm just quickly looking, there's no obstructions that I can see. And then I'm going to palpate. So tell me if there's any pain, okay? So the lobes all the way up to the pinna, and then the mastoid, and then the tragus. Any pain?
No.
Okay. And so that is a normal finding. I'm going to start with a look in his ears, and I'm going to pull the pinna up and back. So I'm in the right ear, and as I'm looking in the right ear, I am seeing just flesh colored. There's no erythema, there's no edema, there's no cerumen buildup, and I'm able to see the handle of the malleus and the umbo. The cone of light is at 5 o'clock. The tympanic membrane is not bulging, and it is not perforated. There's no drainage, and I, again, don't see any erythema or edema back here, no signs of infection. And so that is all a normal finding. I'm going to move over to the left ear, and I'm going to look and see. Again, pulling the pinna up and back, and then as I'm looking in the ear, I am seeing the same findings as the other side. I'm able to see the handle of the malleus, the umbo, the cone of light is at 7 o'clock here on the left, and the tympanic membrane is a pearly gray, and I'm able to see that there's no perforations and there's no sign of infection, and that is all a normal finding. There's no bulging of that tympanic membrane either. Okay, so we're going to move on, and I'm going to do some hearing testing. So I'm going to have you just stand right here. We're going to start with the whisper test. I'm going to have you just cover your ear, so plug your tragus, and then tell me, repeat what I say.
A1, 2.
And then other side, and then
C4D.
Great. So he passed the whisper test, and so next I'm going to do the Weber test. Go ahead and sit down, and go ahead and tell me where you hear this. Do you hear it symmetrically in both ears?
Yeah.
Okay, so he hears it symmetric in both ears, and then the Rin test. I'm placing this on the mastoid bone. Do you hear this?
Yep.
Did it stop?
Yep.
Can you hear this?
Yep.
Great. And then, oh, that's a little loud. Okay, can you hear this?
Yes.
Okay, and did it stop?
Yep.
And can you hear this?
Yep.
Okay, so he is able to, he has air conduction is greater than bone conduction bilaterally, and so that is a normal finding. And so that completes the test for cranial nerve 8, the vestibular cochlear nerve. So I've done cranial nerve 2, the optic nerve, cranial nerve 3, the ocular motor, cranial nerve 4, the trochlear, cranial nerve 5, the trigeminal, cranial nerve 6, the abducens, cranial nerve 7, the facial, cranial nerve 8, the vestibulocochlear. So now we're going to do cranial nerve 1. So I'm going to check your nose, so I can see that your nose is midline. I can see that there's no edema, there's no erythema, there's no hematomas, there's no trauma. It doesn't look like there's any deviations. I'm going to quickly look in your nose, and I am looking to see if there is any, let me see. There is no erythema, there's no edema, there's no polyps, there's no deviation, the turbinates are intact. There's also no pallor, and that is all a normal finding. And then I'm going to look on the other side, and I do not see any erythema, there's no edema, there's no drainage, there's no polyps. The turbinates are intact, they're not edematous, and that is all a normal finding. So I'm going to have you cover, we got to check your nostrils to make sure they work. So go like this. You breathe out of both. Okay, close your eyes. Plug one nostril. Tell me what you smell.
Coffee.
Okay, so, and then other side, and then tell me what you smell.
Vanilla.
Great. So cranial nerve 1, the olfactory nerve is intact, and that is a normal finding. So now I'm going to move on to the mouth and the throat. And so the first thing I'm looking at is I'm first looking at the lips. There's no ulcers, there's no lesions, and there's no excessive drying or like peeling skin. And then go ahead and open, and I'm going to look inside of the buccal mucosa The buccal mucosa is pink and moist. There's no erythema or edema. There's no white patches, and that is all a normal finding. I am looking at the gingiva, and that is also pink and moist. There's no hypertrophy. There is no signs of infection. There is no friability, and there is no like gingivitis, and that is a normal finding. The teeth are well anchored into the gingiva as well. As I'm looking at the teeth, there's no dental caries, there's no plaque buildup, there's no deformities, abscesses, or broken teeth, and that is all a normal finding. And then go ahead and stick out your tongue and then wiggle it side to side. And then as I'm looking at his tongue, I can see, that's good, that it is just a pink and moist. It's not red as you would see with glossitis. It's also not smooth. It has a standard normal rough surface covered with papillae, and that is a normal finding. I'm going to have you just open your mouth and then say, ah.
Aw.
All right, and so as he did that, I was testing cranial nerve 9 and 10. I was just observing him swallow as well. So as I was looking in his throat, I was able to see that the uvula is midline, and the soft palate and the hard palate are intact. There's no exudate, there's no erythema, there's no edema, and the soft palate and the uvula the soft palate moves symmetrically up when he says ah, and then he was able to say ah, he swallows, and then I would elicit a gag reflex, and that is cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus nerve. Also, when I was looking in the back of his throat, I was seeing that the anterior and posterior pillars are intact. They are pink and moist. They are free of any erythema or edema. There's no exudate. And then also his tonsils are present. They are grade 2. And there is no exudate or erythema or edema with those either. And that is a normal finding. I'm going to have you do just a test. I'm going to have you put your tongue into your cheek and then your other tongue into your cheek. Great. And so that is the cranial nerve 12, the hypoglossal nerve, and that is also intact. Tongue was midline, and that is a normal finding. Next, I'm going to do cranial nerve 11, so I don't forget it. I'm going to have you shrug your shoulders. Okay? One more time. There you go. And then turn your head into my hand, and then turn your head into my other hand. So his trapezius muscle is strong. His sternocleidomastoid muscle is strong, and the cranial nerve 11, the spinal accessory nerve, is intact. So I'm going to look at your throat, and as I'm looking at your throat, you can close your mouth. As I'm looking at your throat, I'm looking at the thyroid. I'm not seeing any goiter. I'm not seeing any masses. I'm not seeing any jugular venous distension. I'm also not seeing any tracheal deviation, and that is a normal finding. And I'm going to palpate really quick some lymph nodes. So these are the pre-auricular lymph nodes, and then the post-auricular lymph nodes, and then the occipital, and then this is the posterior cervical, and then the anterior cervical, and then this is the submandible or submandibular, the submental, tonsillar, the supraclavicular, and then I'm going to go out of order. Go ahead and look at your arms. This is the axillary, and then this is the epitrochlear. Do you have any pain with that?
No.
Okay. And so that's most of the lymph nodes. I'll do the inguinal when he's laying down. And so that is normal finding. I'm going to have you stand up so I can palpate your thyroid. And so he's, go ahead and swallow for me. Good job. And then just stand right here. And then I am going to just palpate here. So I immediately feel the thyroid cartilage, the cricoid cartilage, and then right here, let me see, let me get my bearings, is the thyroid. Okay, so go ahead and swallow. Okay, and I can feel the thyroid, it's missed. I don't feel any goiter, there's no masses, and there's no enlargements, and that is a normal finding. So I am going to have you go ahead and sit down, and we will move on. So I have done the eyes, the ears, the nose, mouth, and the throat. And so I think that completes all of that portion. So next I'm going to move on to your chest. So as I'm looking at your chest, I would have him undressed in clinic. But I'm going to do it, just vocalize things over the shirt. So I am first looking for any rashes, lesions, trauma, any scars. I'm looking for any bruising. I'm not seeing any abnormalities. I'm also not seeing any pectus excavatum or pectus carinatum. I am looking anteriorly and posteriorly. I'm not seeing any barrel chest. His anterior posterior transverse ratio is 1:2. And then I'm also not seeing any diaphragmatic breathing. There's no work of breathing. There's no retractions or accessory muscle use, and that is a normal finding. I'm going to palpate your sternum. Tell me if there's any pain.
No.
Okay, so no pain. And then I'm going to palpate your for costochondritis. So tell me if you have any pain. Any pain?
No.
Okay, so there's no pain. Next, I'm going to palpate for tactile phragmitis. So every time my hands are down, I want you to say 99. Like really good. 99. Like
99. 99. 99. 99. 99.
Great. So when he does that, I have even equal vibrations. And then I'm going to measure your respiratory excursion. So go ahead and take a big deep breath in. Okay, and so that is symmetric. My hands move symmetrically up when he breathes in. And so that is also a normal finding. So I'm going to percuss in the in the lung field in a ladder fashion. And I'm doing the anterior and the lateral, and I'm only hearing resonance. I'm not hearing any abnormal percussion sounds. Next, I'm going to just listen. And so basically every time I put my stethoscope down, just take a quick breath, okay? And I'm starting in the apices. Last one. Great. Okay, so I only heard normal breath sounds. I didn't hear any any adventitious breath sounds like crackles, wheezing, or any rhonchi, and so that is a normal finding. I'm going to have you come sit down here, just straddle this, and I'm going to do your posterior side. And so the first thing I'm going to do is I'm going to palpate the spine and the intercostal spaces. So tell me if you have any pain as I'm palpating.
No.
Okay, so no pain. And then on your spine, any pain?
No.
Okay, so there's no pain. And then next I'm going to palpate for tactile phragmitis, so say 99.
99. 99. 99. 99. 99.
Okay, and so that was even an equal vibration throughout, and that was a normal finding. Next, I'm going to check the respiratory excursion, and so I'm going to have you take a big deep breath in, and that is also symmetric. My fingers moved up symmetric, and then I'm going to percuss again in a ladder fashion. Okay, and I only heard resonance. I didn't hear any dullness or any inappropriate breath sounds. Next, I'm going to measure the diaphragmatic excursion with percussion. And so in clinic, I would do this on just his back. I wouldn't have his shirt on. And then I would also do this bilaterally. I'm only going to do it just on the one side. So I'm going to have you take a big deep breath in and hold it, okay? Okay, go ahead and breathe out. And then I'm going to have you take a big deep exhale and take a big deep breath in, exhale, and hold it. Okay, and I'm not marking on his shirt, I'm just making an indentation on his shirt. And I'm going to measure this with centimeters. And as I measure this in centimeters, it is 4 centimeters, so anything between 3.5 and 5 is within normal limits. So as I said, I would do that bilaterally in clinic. I'm only going to do it on the one side for the sake of time. And so I have already, I've already palpated. I have palpated for tactile phragmitis. I have already, percussed. And I've percussed in a ladder fashion. And then I have done, okay, so we've percussed, we've done that, and now I'm going to listen. So go ahead, again, when you feel my stethoscope, just take a breath, okay? Okay, and again, I'm only hearing normal breath sounds. I don't hear any crackles, wheezes, rhonchi, or any abnormal breath sounds. So I'm going to have you go ahead and hop back up onto the bed really quickly, and you can lay down for this, and I'm going to do a cardiac assessment. So I would have him off of, I would have him in a gown and draped so that way I could listen over the clothing. So the first thing I'm doing is I'm noticing that his, there's no precordial pulsations, there's no lifts, heaves, or thrills across the chest. I am also going to palpate the carotids, so I'm going to palpate one at a time. And I'm feeling a +2 regular rate and rhythm with no thrills, and then a +2 regular rate and rhythm with no thrills. I'm going to auscultate the carotids with the bell and the diaphragm, listening for a bruit. And I do not hear a bruit. And there's no bruit with the diaphragm. And there's no bruit with the bell. And that is a normal finding. Next, I'm going to have you just kind of roll over onto your left side really quick. I'm going to palpate the point of maximal impulse or the apical impulse, and then just take a deep breath and hold it. Okay, and I don't feel any lifts, heaves, or thrills. Go ahead and roll back. I was at the 5th intercostal space on the midclavicular line, and then I'm going to palpate for any lifts, heaves, or thrills over the 5 areas of the heart, starting at the aortic, which is the 2nd intercostal space on the right of the sternum. And then the pulmonic, which is the 2nd intercostal space left of the sternum, the Erb's point, which is the 3rd intercostal space left of the sternum, tricuspid valve, 4th intercostal space left of the sternum, and then the mitral valve here in the 5th intercostal space at the midclavicular line on the left of the sternum. And I'm not feeling any lifts, heaves, or thrills upon palpation of any of those areas. Next, I'm going to have you sit up. Sorry, lots of exercise with this one. So I'm going to have you sit up, and I'm going to auscultate with both my diaphragm and my bell in those 5 areas. Okay, so aortic, pulmonic, Erb's point, tricuspid, and mitral. And then with my bell in the aortic, pulmonic, Erb's point, tricuspid, and mitral, and then go ahead and lay down. So as of right now, I'm only hearing normal heart sounds, just S1 and S2. I'm not hearing any murmurs, friction rubs, or gallops. And then I'm going to listen with the patient completely supine with my diaphragm and my bell in those same 5 places. So the aortic, pulmonic, Erb's point, tricuspid, and mitral. And then the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm only hearing normal sounds, so just S1 and S2, no murmurs, no friction rubs, no bruits, and nothing abnormal. So next I'm going to do a little bit out of order. I'm just feeling for radial pulses. These are +2 regular rate and rhythm, no thrills, and then capillary refill is less than 3 seconds. And then I'm going to feel, let me see, we're going to do some pedal pulses, so dorsalis pedis, regular rate and rhythm, +2, and no thrills. And then cap refill in the feet is less than 3 seconds. Posterior tibial pulse, +2, regular rate and rhythm, and no thrill. And then the popliteal is +2, regular rate and rhythm, and no thrill. And so that is all a normal finding. So next I'm going to do your abdomen. I'm going to place a pillow under your legs. That's to help, relax your abdominal muscles. I dropped your phone on the floor, I'm sorry.
It's fine.
I didn't realize it was under there. And then cover you for privacy. Okay, so I'm going to have you just slide down a little bit so you're a little bit more flat. Okay, and so just make sure your stomach is completely relaxed. I would assess my patient, probably more supine, but without a shirt on. And I'm looking at the contour of the abdomen, which the contour is flat. It is symmetrical. I'm not seeing any heaves. There's no dilated vessels. There's no masses, lesions. There's no scars. There's no hernias. And there's no jaundice. And the sclera is free of icterus. I've already noted that. And then the umbilicus is midline, and there's also no hernia there. Next, I'm going to listen for abdominal or bowel sounds in the 4 abdominal regions, starting in the right lower quadrant, this is normal active, 5 to 34. The right upper quadrant, normal active, 5 to 34. The left upper quadrant, normal active. And the left lower quadrant is normal active. Next, I'm going to percuss for tympany versus dullness in the 4 abdominal quadrants, and I'm only hearing tympany. I'm not hearing any dullness upon percussion. Next, I'm going to percuss for the spleen, and I'm not hearing any splenic dullness, which is a normal finding. And then go ahead and take a deep breath. Okay, and then let it out. All right, and then I am going to percuss for the vertical span of the liver, and I'm going to start at the mid-clavicular line at the level of the umbilicus, and I'm going to move superiorly until I hear dullness, which is right there, and then I'm going to mark it, and then I'm going to move down from the level of the nipple till I hear any dullness, which is right there, and then measure it in centimeters, which is, that is 7 centimeters, which is a normal finding. Anything between 6 and 12 is normal. And so next I'm going to palpate. So I'm going to just lightly palpate. Let me know if you have any pain or tenderness, okay? Any pain?
No.
Okay. I'm not feeling any pain in any of the 4 abdominal quadrants. Now I'm going to palpate deeper. Any pain?
No.
Okay. And I'm not feeling any firmness. It's just a soft and non-tender abdomen in all 4 quadrants with light and deep palpation. Next, I am going to palpate for the kidneys, which I am not able to palpate on the left or the right. They would only be palpable if they were quite enlarged. And then I'm going to try and palpate for the spleen. Take a big deep breath. And I'm not feeling any spleen, which is a normal finding. And then I am also palpating for the bottom edge of the liver. So go ahead and take a deep breath. Okay, and then let it out. And then I'm able to feel the bottom edge of the liver. It is smooth, it is regular, there's no irregularities to it, no nodules, and that is a normal finding. Next, I'm going to palpate for any masses in the aorta. So there's no pulsatile masses, and I don't feel any aortic pulsations, and that is a normal finding. And then I am going to palpate the inguinal lymph nodes. Any pain?
No.
And then the femoral lymph nodes bilaterally. And then I actually made a mistake. I would go back and I would do this in a different order. I would have listened before I started touching. I would listen to the patient's abdomen with the bell and the diaphragm on the abdominal aorta, and the left and the right renal arteries, the left and the right iliac arteries, and then the left and the right femoral arteries with the diaphragm. And then again with the bell, I'm listening for any bruits at the abdominal aorta, the left renal arteries, and then the left iliac arteries, and then the left femoral arteries. And there's no bruits. I would have done that. I should have done that. So I would go back and I would do that again. I'm not going to, but I would change the order. So that would have been done in the order after I listened to bowel sounds. I would have then listened for any the abdominal vasculature. And so that completes most of that. I'm going to have you sit up really quickly, and I'm going to test your back for costovertebral angleness tenderness. And so this is at the level of the 12th rib, and I'm going to just percuss like this on the level of the 12th rib. Any pain? Okay, so there's no pain. Any pain on the other side?
No.
Okay, so that's negative for any pyelonephritis. Next, I am going to move on. We're going to do the spine. So I'm going to have you stand up for this one. And so first thing I'm actually going to do is I'm going to check your gait and your balance and coordination. So I'm going to have you take a couple of steps forward, and then I'm going to have you walk back to me on your toes. Go ahead and walk back to me on your toes, and then your heels. Walk on your heels. Okay, great. And then I want you to do a tandem walk, which is with one foot in front of the other, heel toe, heel toe. I'm going to just stand over here so I'm still in the frame. Great. Okay, so his gait, balance, and coordination is intact. His posture is upright. As I'm inspecting the spine, I'm seeing that his posture is upright. His shoulders are symmetric. His iliac crest is symmetric, and then I would also assess the skin folds of the buttocks. And then I'm going to assess from the side. I'm seeing that there is no, there's no cervical or lumbar lordosis. There's no dorsal kyphosis, and that is all a normal finding. And I don't see any indications of any scoliosis. So I'm going to have you turn this way and then bend over 90 degrees. And then as he's moving, I can see that he's making really smooth, symmetric movements. His shoulders are still symmetric. The shoulder blades are still symmetric, and the hips are symmetric, and there's no abnormal curvature of the spine, so I'm not concerned about scoliosis. Go ahead and come up, and then I'm going to have you tilt back towards me. Great, so that's part of our range of motion. I'm also going to palpate the spine. I'm palpating the spinous processes and then the intervertebral spaces. Do you have any pain?
No.
Okay, and so that's a normal finding. And then next I'm going to have you do, let me see, I'm going to percuss the spine. Any pain?
No.
Okay, and then we'll do some range of motion. So I'm going to have you, we'll quickly do this. We're going to do flexion, extension, and then we're going to do some lateral rotation, over, and then over. And then we're going to do some, you already did forwards and backwards. Now we're going to twist, and then we're going to twist, and then we're going to bend and bend. Great. Ooh. Okay, his balance is a little off. Okay, so that completes the spine. So I'm just going to have you sit really quickly. I think we're getting pretty close on time. And so I'm going to assess your upper extremities. So I'm assessing, again, the shoulders, the elbows, the wrists, and the hands. And I'm doing this without a shirt on, just like I did his spine without a shirt on in clinic. I'm assessing for symmetry. I'm assessing for nodules, deformities, atrophy, and any redness or swelling. And I'm not seeing any in the shoulders. I'm not seeing any redness, swelling, deformities, nodules in the elbows, redness, swelling, deformities, nodules in the wrists or the hands. So I'm going to start by palpating the shoulders. I'm palpating for any fluid or any tenderness, so tell me if there's any pain. This is the acromioclavicular joint, the coracoid process, the subdeltoid, the subdeltoid bursa, the biceps groove, and then the tubercle of the humerus. Any pain?
No.
Okay, and so I didn't feel any abnormalities. And again, I am also palpating bilaterally for comparison. And then I'm feeling symmetry. I'm palpating the olecranon process, the extensor surface of the ulna, and then the medial and the lateral epicondyles. Any pain?
No.
And I'm not feeling any nodules or any abnormalities. And then in the wrist, I'm palpating, starting with the metacarpals and the carpals. Any pain?
No.
Okay, no pain, no nodules, no swelling, and no tenderness. And then the fingers, I'm starting at the distal interphalangeal joint, the proximal interphalangeal joint, the metacarpal phalangeal joint. Any pain?
No.
Okay, so no pain, no tenderness. So starting with your hands, make a fist, and then abduct, and then adduct, flex, and extend. And then your wrists are going to go flex, extend, and then we're going to adduct, and then abduct. Great. And then your elbows, we're going to supinate, so we're going to extend, flex, and then extend again, and then pronate. And then your shoulders, this one's easier done standing. And so I'm going to have you do, you're going to go up 180 and then back 60, and then you'll abduct. There you go. And then you're going to adduct across the midline. And then we're going to do internal rotation where your hands are on the small of your back. Okay. And then external rotation, hands are on your neck. Okay. And did you have any pain or discomfort with any of that?
No.
Okay, great. And then, so now I'm going to do what we call a 2-point discrimination. So I'm going to have you sit down, close your eyes. I want you to tell me if this is 2 points or 1 point. Okay. Oop, if I can hold it. Okay.
2, 2, 2, 1, 1, 1.
Okay, and we'll do the other side.
2, 1, 2, 1, 2, 1.
Okay, so he's able to accurately identify the 2-point discrimination, and then I'm going to test sharp versus dull. So
Sharp, dull, sharp, sharp, sharp,
okay, sorry, I went too fast.
dull,
Okay.
sharp, dull, sharp.
Okay, and he's able to identify the difference between sharp and dull with the cotton-tipped applicator in the upper extremities. And so I'm now going to do, let's see, I'll do your reflexes last. So I'm going to have you lay back down and we're going to do your lower extremity. So again, I would do this without the clothing on. So I'm going to assess the hips, the knees. So first, as I'm assessing the hips, I would look at the alignment. I would start on the right side of the bed and move around to the left side of the bed. As I'm looking at the alignment of the hips, I see that they are aligned. I'm not seeing any redness, swelling, deformities, any asymmetry. I'm not seeing any concerns with the hips. And then as I am inspecting the knees, I am looking at the knees for any redness, swelling. I'm also looking for valgus or varus deformities, and I'm not seeing any valgus or varus deformities. I do see a little scab on the knee though. And then I am looking at the ankles for any discoloration. I'm looking for redness, swelling, asymmetry, nodules. And then on the feet, I'm looking for redness, swelling, nodules, deformities. I'm looking for bunions, corns, calluses, any plantar warts, and I'm not seeing any. So I'm going to start with palpating. Actually, we'll start at the top. I'm going to palpate in the hips, and I'm palpating the anterior, superior iliac spine. Do you have any pain?
No.
Okay, and then I'm palpating the posterior, superior iliac spine. Any pain?
No.
And then I'm palpating the sacroiliac joint. Any pain?
No.
Another easy way to do that is to have the patient bring their leg up into a, to flex their knee, and then do a slight internal rotation of the hip, and then you can access the backside easier. But he's rather, he's smaller, and so I'm able to, sorry, I didn't mean to offend you. He's a smaller person, and so I'm able to do that without having to use too much energy. And so anyways, I'm also going to palpate the greater trochanter. And any pain?
No.
Okay, and I'm not feeling any abnormalities. There's no crepitus, there's no swelling, and there's no fluid. Next, I'm moving on to the knees. I'm palpating the suprapatellar pouch, and then the side of the patella. And then I'm palpating the popliteal fossa for a Baker's cyst, and I'm not feeling any abnormalities there. I'm palpating the ankles. Did you have any pain as I was palpating any of that?
Just that scab.
Yeah, I'm sorry. How'd you get that?
Turf burn.
Ooh, were you playing soccer?
Yeah.
Ooh. Okay, and then I'm palpating the medial malleolus. Any pain?
No.
Lateral malleolus.
No.
Okay, and then the Achilles tendon and the gastrocnemius. Any pain?
No.
So there's no nodules, there's no swelling. I don't feel any abnormalities with any of that. And then I'm going to move on to the feet. So I am palpating the first for a Morton's neuroma or an interdigital neuroma. Any pain? Okay, and then the distal interphalangeal joint and the proximal interphalangeal joint. Any pain?
No. And
then the metatarsals. Any pain?
No.
Okay, I don't feel any abnormalities or anything with that, and that is all a normal finding. And so we'll start with some range of motion. So with your feet, I'm going to have you just curl your toes and then extend your toes. Great. And then I'm going to have you with your, I'm going to have you push down you're driving a car. That's called plantar flexion, and then dorsiflexion. Great. Okay, and that's all even. I can feel that. And then I'm going to have you make circles with your ankles. Good job. Okay, and he's able to do that. And then I'm going to have you flex and extend your knees. So just, bring them up like that. Sorry, that hurts. Okay, and that one. And extend. Okay, and then I'm going to have you, we're going to do lots with your hips. So flex your hip up. Okay, and then flex your hip up. You having some stiff range of motion today? Okay, so he does have some stiffness with his range of motion. And then also with the hips, I'm going to have you do some internal and external rotation of your hips. Do you know how to do that? Okay, so that one has a scap, so I'll demonstrate it with this one. So bend your knee, and then you're going to bring your hip up, and then that's external, and then that's internal. Okay, and then down, and then you're going to do the same thing if you can with this one. Okay, internal, external. Good job. Put it down, and then I'm going to have you abduct. So bring your leg out to me, and then adduct across the pillow. Okay, and then do the same thing with the other side. So adduct, good job, and then adduct, and then aside from that scab, are you having any pain or difficulty with your range of motion?
No.
Okay, and then I'm going to quickly do some strength. So I want you to curl your toes, and then I'm going to try and open them. Okay, so he's +5 strength. And then I'm going to hold your feet down and then pull them back. So he's +5 strength in his ankles, and then I'm going to hold your tibias down. I want you to flex your knees up. There you go. So he's that's good. He's +5 strength in his knees, and then In your hips, I want you to bring your legs up just to resist me to show that you're strong. There we go. So +5 strength there. I didn't do your strength with your upper extremities. I need to do your reflexes. So first I'm going to do your Babinski reflex. And that is a negative Babinski. There was no dorsiflexion of the toe. And then I'm going to have you sit up at the side of the bed because I'll have to do the rest of your reflexes. And we'll do your 2-point discrimination as well. Okay, so I'm going to try and push in, so push out. So +5 strength in the shoulders. And then we're going to test your elbows, which is basically your biceps. So I'm going to push down. Okay, +5. And then your wrists, I'm going to push down and you're going to push up. Good job. And then your fingers, don't let me keep trying to open them. Okay, and +5 strength in the fingers, and that is a normal finding. 2-point discrimination, the 2 tests in the lower extremities, so close your eyes. And then I'm going to tell me if this is 2 points or 1.
2, 2, 1, 1, 2, 2, 2, 1.
Okay, so 2-point discrimination, he's able to identify the difference between 2 points and 1, and then we'll do soft versus hard. So tell me if this is sharp. Soft versus sharp, sorry.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Great. Okay, and then I'm going to do, so since I'm down here, I'm going to start with your Achilles reflexes. So I'm going to dorsiflex the toes, and that's +2. And that's +2. I've already done the Babinski. I'm going to have you put your hands like this, okay? And I'm going to do your patellar reflexes. Maybe. There we go. That's +2. And then I'm going to do your biceps. Go ahead and put your hand just kind of like that, and we'll do bilateral. +2. And then I have to try and stay in the camera frame. Okay, +2. Whoops, sorry. And then the brachioradialis here. +2. +2. And then we'll do the triceps. So I'm fully supporting this arm. +2. And then +2. Okay, so all of those are intact. I feel like I did it all. Okay, thank you so much for your time.